beaming across the eastern townships from the heart of Brome-Missisquoi. This is 99.1 CIDI.
Welcome to the Alternatives. You have choices. Hello, my name is Ilya Kavukis, and I am your host here on this show, weekly show that airs twice a week, Tuesdays at 5 and Thursday mornings at 8:30. Tuesdays is in the afternoon, and it's an alternative medicine show. We have guests that come and talk about all their wonderful things that they do to help people. We are broadcasting from our station here in Knowlton, CIDI 99.1. We are coming from my center is the Sunshine Center in Sutton, where I work, and also have some other therapists that come and join us and do some wonderful things, therapies, and teaching some courses like yoga, some qigong. We have a wonderful song circle where we have a fabulous choir director who comes and teaches us some songs, and we also do some improv, which is my personal favorite. And we also have an infrared sauna that it's a private room. People come in and enjoy their time while they sweat out all their things that they don't need anymore. So today, my guest is a wonderful person, as all my guests are. Her name is Elizabeth Wallace. Hello, Elizabeth.
Hi, Ilya. So pleased to be here.
Oh, thank you. It's so nice to have you. You're also in the Song Circle on Monday nights with us, and I was going around the Song Circle thinking, who can I invite? And then you were there like, of course, Elizabeth. Elizabeth, I know you do lots of wonderful things. One of the things you do is you're a massage therapist like me.
Yes, I am.
Yeah. And I remember going for a treatment with you a couple of years ago and just really, really appreciating that in your house in a beautiful mountainous valley in Sutton. And it is so worth going there and seeing you and having a treatment with you. And I would love to know, how did you first get started? What got you interested in alternative therapies?
The first and foremost was when I first began as a nurse to work on palliative care. And there I was put into contact with a lot of different ways to modulate pain and approach the dying. When I was working on the ward and also as a consultant in the hospital, I was put in contact with much of the information of Dr. Ronald Melzack, who wrote the Gait theory. He's a physician in McGill, and he's done a lot of research and had a pain clinic at the Montreal General. What really interested me was he had 3 different areas of the nervous system which modulate pain. The first is what is called the sensory information coming from the pain or from the body, going into the spinal cord to what we call the dorsal horn. But that's not so important as the fact that when you use heat, cold, pressure, vibration, it runs along nerve fibers that are insulated, just like in your home. But the chronic pain fibers come into the same area, but they are not myelinated or not insulated. And what this means is the pressure, the cold, the heat, the vibration, and other modulus, they go much faster into the spinal cord. So they sort of take up all the place. And so
you can't ignore them.
They can't ignore them because they go in, and what happens is the chronic pain fiber doesn't have as much space in order to take its message up to the cortex of the brain and say, it hurts. So that's why many alternatives actually work? Because I'm always interested on the science side and the alternative side. How does it work? And I think right now in our society, we're looking for how does the traditional and the alternative work together. But I've sort of got off the subject. So now I'll go up to the second area, which is the brainstem or the midbrain. And it's just sort of under the top of the neck. And what happens there is often when you're meditating or you're very distracted, the pain message comes up to that area and it says, oh, it's too busy here, I'm going back. So the actual strength of the pain is less. It still is there, but because people are meditating or distracted by their visitors or they're reading a good book, they don't feel the pain as much. And that often happens to people is why in the middle of the night, pain is more severe because this area is open. And the message goes directly to the cortex and says, ouch, it hurts.
So I just have a question. Chronic pain is basically you've been ignoring or you haven't been getting the signal that the pain has been...
No, these are ways of the pain has always been there. But this is how to make it, how to lessen it.
Okay.
Because you want to lessen it.
Yeah.
And the medication and things like that are very useful. But when you look into areas of Qigong and China and what's in India and yoga and things, they do use that, they modulate the pain that way.
Okay.
So this is why it's important.
Okay, so it's important to be present in your body, to be aware of what's happening. Is that what I'm understanding?
Not at all. No. It's these different gates open and shut, and they help to reduce the amount of pain. The amount is always the same.
So how do we reduce it?
Well, the first one was with pressure, cold, heat, irritation, vibration,
yeah. Okay.
and that what it does is it excites those nerve fibers that carry those messages, so that the chronic pain message fiber cannot have as much place as it wants.
So before we get to the third area, I would just like to tell our listeners that they're listening to CIDI 99.1 FM, and this is The Alternatives. You have choices. Your host, Ilya Kavukis, and my guest, Elizabeth Wallace. We're talking about massage therapy and how that helps to manage our pain in our body. So please continue, Elizabeth.
So one of the third gate is really the cerebral cortex, and where we have anxiety, where we have knowledge. And it's been proven that the more knowledge that people have, say when they're going to have a surgery, that they know what to expect the next day, what's being done, or even if they're given a morphine pump, what happens, and they have the control of it, they use much less medication and they have much less pain.
Wonderful.
So these are kind of the areas that really excited me about alternatives. And I was then attracted to learn about different kinds of massages. So I went to school in Montreal where we learned Oriental, where we learned Swedish and Californian in a holistic approach to the patient or to the client.
Wonderful. I'm curious. Let's expand on the Swedish massage, because I do that as well. So I'd love to expand on that subject with you and I.
So that's a basic massage that's taught in many schools and has been around for a long time, using oils and deep tissue manipulation for relaxation. Californian is much with very long strokes and lighter and calmer. So it depends on what your client wants.
Okay. Yes. There is a big demand for that now. It's becoming more and more popular. So you're trained in Californian as well?
Yes, I am.
Oh, wonderful,
Yeah.
Wonderful. Yeah, so Swedish covers the whole body. It could be deep tissue. It could be light. Because some often when I have a client comes in, and I ask about depression, they say, well, I like Swedish, but I don't want it really deep. Oh, no, I said, that's fine. I say, you can have both. You can have either one. You can have in between.